San Antonio and Bexar County have just issued new emergency orders. The new stay home, work safe orders start tonight and last through May 19th. They're keeping the rule to wear masks in public, and they're still banning public gatherings. They want to continue to protect the public as the governor allows more businesses to open on Friday. We'll have a full breakdown of the new orders in just a few minutes. But first, all new at 10, a 30-year-old San Antonio man survived the coronavirus even after a ventilator couldn't help him. Instead, doctors used a machine some are calling a last resort Hail Mary option to save lives. Tonight, we're hearing from the survivor and his doctor. Plus, only Eyewitness News reporter Henry Ramos shows us exclusive video from inside the coronavirus floor where this treatment took place.
Suited up in PPE, this team of dedicated healthcare workers are at ground zero for the coronavirus inside Methodist Hospital. They're treating patients like Nick Wilson.
Just so glad to be back to healthy.
His battle with the virus almost cost him his life. The 30-year-old was in 2 hospitals for 24 days.
I was struggling to get any sort of air into my lungs, and unfortunately, that was when my mom had gone to pick up my dad from the hospital, so I had to wait until she got back.
The same day he couldn't breathe, his father was getting out of the hospital. He had survived the disease. Nick's mother had it too and was recovering at home.
And that's probably where I got it from.
Before fully recovering at Methodist in this specialized coronavirus floor, Nick was treated at Northeast Baptist Hospital. He wasn't doing well. Doctors put him on a ventilator, but that wasn't working.
I didn't believe in giving up on anything.
With a high chance of dying, Nick was sent to Methodist Hospital. Here, they're treating coronavirus patients with this machine called ECMO. The ECMO program at Methodist is one of the largest in the world.
You don't want to be too early and put someone on ECMO who didn't need to be on ECMO. You don't want to go too late and miss the opportunity to save someone who you could have saved.
ECMO was used on Nick because his lungs were failing. The machine requires tubes to be placed into a vein or artery.
One that sucks blood out of the body, it puts oxygen into the blood, and then it puts that blood with oxygen in it right back into the body. It can help patients who are in lung failure or heart and lung failure to be able to recover.
It didn't feel all that strange at the time. Did barely notice it.
An army of staff working round the clock, taking care of Nick and other very sick patients.
This really is medicine at its finest. It's people who are truly dedicated to the cause of helping people, and that's inspiring.
Nick was on the machine for 3 days. It was a success.
It's kind of amazing how quickly I got better. You don't want to get this disease. It might not hit you as hard as it hit me, but it can hit any of us this hard.
Henry joins us live from Methodist Hospital. Henry, how many coronavirus patients have been on the ECMO machine?
Deborah, staff here have treated 11 patients. 5 of them are still on ECMO. 4, including Nick, survived and are at home. Now 2 didn't make it. And ECMO was used before in 2009 during the swine flu pandemic. As for Nick, he has been at home for a week in self-isolation. At first, he had trouble walking, but is doing fine tonight. What a story of survival. Reporting live tonight outside Methodist Hospital, Henry Ramos, KENS 5, Eyewitness News.
Yes, Henry, and what an incredible look inside that coronavirus floor and those heroes working there. Well, there are 2 new coronavirus deaths in Bexar County tonight. That brings the death toll to 46. 19 new cases are reported this evening for a total of 1,326. The mayor says we have slowed the spread. New at 10, dozens of new coronavirus cases inside the Bexar County Jail. The sheriff's office says 34 more inmates have tested positive. That raises the total to 98 inmates with the coronavirus. 5 new detention deputies have tested positive too. A total of 40 detention deputies and 1 law enforcement deputy have become infected. Now let's get back to the steps local leaders are taking to keep San Antonio and Bexar County safe as Texas reopens in 2 days. As we mentioned at the top of the newscast, the stay-at-home orders have been extended until May 19th in our community. My co-anchor Aaron Wright joins us with what this means. Aaron?
Deb, two big things. You have to wear a mask in public if you can't maintain social distancing. Secondly, a business that was closed by any previous order and was not reopened by the governor, that must stay closed. These new orders issued by the city and county aren't designed to compete with the governor's order, but Judge Wolf said without these rules, the governor's plan will fail. Public gatherings are prohibited. Non-essential businesses that try to reopen could face a $1,000 fine or jail time. And the order is making face masks mandatory in public for everyone 10 and older when you can't maintain social distance. Under the governor's order, the city and county cannot penalize you for wearing a face covering, but Judge Wolf says he hopes businesses will help enforce the mask rule.
Businesses in their own interests are not going to let people come in without face masks, and they understand that's a threat to their customers and a threat to their employees. So if somebody tries to go into a store and we have that mandatory face mask, and the owner of the business is helping us, that could be a criminal trespass. So it may not have the fine, but there's other measures to make sure that people are doing that.
Local leaders are also asking anyone that might be considered high risk, that includes diabetes, high blood pressure, or the elderly, to please stay home. Deb, back to you.
All right, Aaron. The new city and county orders also address antibody testing with a warning against tests that aren't approved by the FDA. Antibody tests are supposed to prove who's been exposed to and recovered from the coronavirus. They are different than the nasal swab tests, which check to see if you currently have the virus. Eyewitness News reporter Vanessa Croy explains the concerns over this type of testing.
You're seeing a lot of emphasis with people wanting to do antibody testing to see whether they have had it and they've recovered but didn't know. I want you to be very cautious of this.
Metro Health Director Dr. Dawn Emmerich issued a warning about antibody testing. It's a blood test that looks for evidence of past infection. New York randomly sampled 3,000 people last week in the largest antibody survey in the nation. Some health officials say surveying those who have developed antibodies against the virus could be the key to fully reopening the economy. The World Health Organization saying last week that many people could have been infected without realizing it, but shouldn't use the test as, quote, immunity passports. Experts say that's because there's still too much unknown about the virus to guarantee immunity. Dr. Barbara Taylor chaired the city's health transition team, echoing the need for more data on if the tests are effective.
So we knew that the testing was reliable and accurate, and we knew that having antibodies actually conveyed immunity or protection from infection. That could potentially be a game changer.
And another concern surrounding the tests. Companies making false claims about effective tests and marketing those tests to consumers. Of the 160 tests on the market, only 8 have been approved by the FDA.
Even with the FDA approval, we're not sure whether they are working or not. So this is not a statement or a position to say that they're not of value. I think that it's too early. The science just isn't there.
Vanessa joins us live. Vanessa, does Metro Health advise on where to get the FDA-approved antibody tests in San Antonio?
Well, Deb, they don't. Metro Health says they can't regulate testing providers. And even when someone goes and gets one of these antibody tests, the results are not reported back to Metro Health like they would be in the case of a positive coronavirus test. Metro Health suggests reaching out to your primary care physician for more information on how you can get one of these antibody tests. Reporting live tonight, Vanessa Croy, KENS 5 Eyewitness News.
Thank you, Vanessa. Entertainment is picking back up. Several movie theaters are opening their doors. Under Governor Abbott's order, theaters can operate starting Friday with a limit of 25% occupancy. Santico says it's opening its Casablanca, Palladium, and Cibolo locations on Saturday. Evo Entertainment will open its locations in Kyle and Schertz on Monday. However, Alamo Drafthouse says it will remain closed this weekend. We have a full list of theater openings online at KENS5.com and in the KENS 5 app. Taco Cabana is returning millions of dollars it received from a program that's supposed to help small businesses. We told you last week the chain, which started in San Antonio, accepted a $10 million loan. The money came from the Paycheck Protection Program, which is a fund from the federal government. It's generally limited to help small companies stay afloat, but an exception was made for restaurants. Still, Taco Cabana, which has nearly 150 restaurants, was criticized for the move. Today, the chain's corporate owners announced they would return the money. The coronavirus outbreak inside a local veterans home is growing even more deadly. Tonight, the mayor of Floresville says 3 residents have died at the Tejeda, Texas State Veterans Home. 14 residents and 8 staff members have tested positive. New York has been the epicenter of the U.S. coronavirus pandemic. The state is nearing 300,000 cases. New York's Governor Andrew Cuomo plans to slowly reopen starting next month. And a former San Antonio mayor will help make it happen. Henry Cisneros will be on Cuomo's reopening advisory board. The two served together in the Clinton administration. Cisneros is the chairman of a New York investment firm.